Hello. Today we delve into a developing global health crisis as the World Health Organization declares the recent surge of MPOX in Africa a public health emergency of international concern, or PHEIC. This marks the second time in 2 years that MPOX has received this grave designation. So, what exactly is happening and why should we be concerned? To understand the gravity of the situation, let's first unpack the details of this latest outbreak. The WHO's Director General, Dr. Tedros, made this declaration following an alarming rise in MPOX cases, particularly in the Democratic Republic of Congo. This resurgence is not just confined to the DRC, but has also spread to neighboring countries like Burundi, Kenya, Rwanda, and Uganda, with over 15,600 cases and more than 530 deaths reported so far this year. But why is this outbreak considered so serious? Why the global alarm? What makes this particular outbreak of MPOX different from previous ones? The WHO's concern primarily stems from the emergence of a new strain of the virus, known as Clade 1b, which is proving to be more transmissible and possibly deadlier than earlier strains. Unlike previous strains, which were mostly contained within specific regions and transmitted through contact with infected animals, Clade 1b is spreading more easily through human-to-human contact, particularly within sexual networks. This shift in transmission dynamics significantly raises the stakes as it could lead to more widespread and rapid dissemination across borders. Historically, MPOX has been endemic in certain parts of Central and West Africa, first identified in humans back in 1970 in the DRC. For decades, it remained relatively contained. However, last year, the global community witnessed an unprecedented spread of the virus outside its traditional hotspots. The 2022 outbreak, primarily driven by Clade 2, spread to countries that had never seen MPOX before, forcing WHO to declare a PHEIC, which was eventually lifted in May 2023 after cases declined. Now, with Clade 1b on the rise, we're seeing a return to crisis mode. This clade's ability to spread through sexual contact has not only increased its transmission rate, but also expanded its reach into communities and countries that had previously been MPOX free. You may ask, how is the international community responding and what measures are being taken? Well, Dr. Tedros emphasized that this situation demands a coordinated international response. To this end, WHO has initiated several key measures, including the emergency use listing for MPOX vaccines aimed at speeding up access for lower-income countries. WHO is working with vaccine manufacturers, the UN Children's Fund, and other global health partners to ensure equitable distribution of vaccines, therapeutics, and diagnostics. But it's not just about vaccines. The WHO is also rolling out a regional response plan that requires an initial $15 million to bolster surveillance, preparedness, and response efforts across the affected countries. Already, $1.45 million has been released from WHO's Contingency Fund for Emergencies, with more funding anticipated in the coming days. The spread of MPOX beyond Africa highlights a critical issue in global health: the interconnectedness of our world. Infectious diseases can no longer be viewed as isolated to one region. What happens in one part of the world can quickly have far-reaching consequences. Dr. Matshidiso Moeti, WHO's regional director for Africa, echoed this sentiment, stressing that while efforts are underway to contain the virus within Africa, the risk of global spread remains real. The rapid and unchecked transmission of Clade 1b could potentially lead to another global health emergency, reminiscent of the COVID-19 pandemic, albeit on a different scale. So where do we go from here? WHO's recommendations are stated: enhanced community protection, tailored public health measures, and a unified international response. The extension of standing recommendations for another year is an acknowledgement that the fight against MPOX is far from over. As we monitor this situation, it's crucial that global health leaders and communities alike remain vigilant. The world is watching, and the decisions made now will determine whether this outbreak will be contained or we face another global health crisis. I'm Cynthia Nivyawandi, and you're watching the African News Network. Thank you for joining us.